everybody. Today I'm glad to be here to give the lecture, Heat-Sensitive Mouse Bulging. My name is Liu Bushui. I'm a professor and a doctor of the Affiliated Hospital of Jiangxi University of Chinese Medicine. Heat-sensitive mouse bulging is a brand new mouse bulging therapy originated from our university. The founder of this therapy is Professor Chen Rixin and his team. So today, I'm going to introduce this therapy from 5 parts. Introduction of mouse bulging, because this is a new branch of mouse bulging therapy. And what is HSM, heat-sensitive mouse bulging? And 6 phenomena of HSM. And the indications of HSM is what kind of diseases this therapy can treat or can help, and how to do this therapy. So procedures of HSM. First, introduction of mouse bulging. In Chinese medicine, acupuncture and mouse bulging is a very important part. And acupuncture means needling therapy. Mouse bulging means they ignite the muscle to the certain areas of body. And these 2 parts are very important of Chinese medicine. It can treat a lot of diseases. And mouse bulging has a long history. It can trace back to ancient China. Actually, it has the history more than 2,000 years. In the medical classic of Yellow Emperor, it says, where the acupuncture is not proper, the mouse bulging should be used. It means the meaningful and the function of mouse bulging is very, very important. So mouse bulging therapy usually have these 3 kinds of therapy: indirect mouse bulging therapy, and direct mouse bulging therapy, and suspended mouse bulging. The first picture, like we use the bony mouse touch the skin directly. We call this is direct mouse bulging. And second is objects partitioned therapy. Usually we use the sliced ginger. We put the sliced ginger between the skin and the bony mouse. And the third one is suspended. So the bony mouse and the skin are not touched. So there's some distance, usually 3 to 5 centimeters. And heat-sensitive mouse bulging belong to the suspended mouse bulging. Next. So studies shows HSM, heat-sensitive mouse bulging, has much better clinical effect than traditional mouse bulging. And in this, actually, heat-sensitive mouse bulging is a kind of very successful technology reform and innovation of mouse bulging. So this is the traditional one, and the new one, HSM. The traditional one, we see marks on the surface, heat on the surface, and marks on the local, and heat on the local. And in HSM, things comes different. It's like marks on the surface, but heat inside, marks on the local, but heat in the distance. In this kind of words, give us some questions. It's a little difficult to understand. Later, I will show you. This is because marks on the surface, how the heat inside. This is the sensation from patients. Studies have proved that the curative effect of HSM is better than the traditional mouse bulging therapy. And it more than 30 years of research. So what is heat-sensitive Moxibustion? This is the definition. Acupoints with one of the 6 phenomena of HSM are heat-sensitive acupoints. So it means first we have to find the heat-sensitive acupoints, and then we use the burning marker on this kind of points. Then this therapy we call the heat-sensitive Moxibustion. So how to find heat-sensitive acupoints? This is the key problem. What is heat-sensitive acupoints? If we use the burning marker on the skin surface, and then these 6 sensations come out, we define them as heat-sensitive acupoints. So come to 6 phenomena of HSM. The first one is diathermy. Let's look at this picture. We use the burning marker on the surface, and the heat go inside, penetrate the skin, and go inside. So the patients will tell you, I feel the heat go through the skin and deepen in the very deep. This is diathermy, we call. Second, heat expansion. Definitely, if we use one burning marker stick, definitely there's area of heat patient will feel. But usually, patient feel the diameter is about 3 centimeters. And we call heat expansion, then the diameters more than that, it comes to 5 centimeters, even more, 10 centimeters, a lot. So we call heat expansion, like this picture. Third is heat transmission. Heat transmission, like this picture, the heat will go to a direction. Usually, the point and in the affected area where the disease is in. The first, local non-heat with distal heat, hotness, or micro. Actually, non-heat is not possible. Usually we call micro heat. So, like this picture, the patient don't feel the hotness on the area that the Moxibustion on skin, and the patient will feel in other place, in distal place, there's hotness. So, and this point is distant from the Moxibustion, like this picture. Fifth, superficial non-heat with deep hotness, or micro heat with deep hotness. Like this picture, the patient will feel the hot go inside in deep, but in superficial, on superficial of skin, there's no heat. Patient doesn't feel or feel very, very few hotness. This is very strange. The sixth one is other non-heat sensation. How non-heat sensation? In clinical, we found some patients, when we do Moxibustion, the patient will tell the doctor, I don't feel hot. I feel other sensation, like heaviness, pressure, distending, soreness, pain, numbness. Even very, very few patients will tell doctor, I feel cold. This is also a kind of phenomena of HSM. And this is very useful. So it can produce small stimulation, inducing large response, getting much better effects. And not just local and superficial heat sensation of the acupoints. This phenomena we call acupoint heat sensitization. And the point is called heat-sensitive endpoints. So mouse bulging to this kind of points we call heat-sensitive mouse bulging. And remember, one thing is very important. This kind of six phenomena of HSM usually happened in unhealthy condition, not in healthy condition. So if a healthy person, he usually don't have six phenomena of heat-sensitive mouse bulging. But when the person gets sick, gets illness, like pain, like diseases, and then we can find heat-sensitive endpoints. So this is very important. So for healthy people, usually they don't have heat-sensitive endpoints. But for unhealthy, disease, illness people, we can find heat-sensitive endpoints. And in infrared images, we can see the picture. So in the right side, we do the mouse bulging on the shoulder, and the heat goes up to the head, to the neck. So also have this kind of evidence. So for indications of HSM, what kind of diseases HSM can cure or can help? Theoretically, all indications of traditional mouse bulging. So it means all the diseases, all the conditions that the traditional mouse bulging can treat, heat-sensitive mouse bulging can treat. So it includes different system diseases like respiratory system called allergic rhinitis, bronchial asthma, chronic bronchitis, and also digestive system and nervous system and reproductive system and musculoskeletal system. In this system, is very common in the clinical practice, like pain conditions, neck pain, lower back pain, shoulder pain, knee pain, and elbow pain. All kinds of pain syndromes we do. And how to do the HSM, how to practice. This picture is the founder of HSM, Professor Chen Rixin. First, we have to find out the heat-sensitive acupoints. Definitely, this is for unhealthy persons. Second, try to our best to trigger the sensations, 6 phenomena of HSM sensations. And third, make sure the sensation propagated along the channel like acupuncture. This is very important because in acupuncture theory, if the sensation, if the qi arrival, and then we can get much better effects. For mouse bulging, for heat-sensitive mouse bulging, the same thing. We have to find the qi arrival. We have to find this kind of sensation, and then we can receive better clinical effects. Otherwise, the effects is not good. First, exploring for heat-sensitive acupoints. So for this, we have 3 steps to do to complete this step. First is circling mouse bulging. What is circling mouse bulging? So we use the bony mouse stick. We just circle around the point gradually and evenly, usually for 1 to 3 minutes. We stop the mouse bulging until the mouse bulging point, the skin get red or the patient feel heat. Second, back and forth mouse bulging. We use the bony mouse stick, go forward and backward gradually, gradually and evenly. So the same thing, we stop the mouse bulging until the patient feel heat or the mouse bulging point becomes red, and then we stop. Spiral packing mouse bulging. This is very interesting. We use the bony mark stick, like this, like sparrow pecking at the ground, like this picture, up and down, gradually. And we stop the moxibustion until the moxibustion point skin becomes red or the patient feels heat. After this kind of exploring heat-sensitive acupoints, and then we go to the mild moxibustion. If we find this acupoint is heat-sensitive acupoint, and then we use the moxibustion, suspended moxibustion on the heat-sensitive acupoint. So we keep 3 centimeters between the bony mark stick and the acupoint or affected body part. So we hold a mark stick above the area until it feels hot but not painful. Very importantly, patient usually feel very comfortable. Maybe superficial non-heat or micro heat and deep heat, or other non-heat sensation or heat expansion or diathermy like this, or heat transmission. These six phenomena of HSM. And then when we stop this mild moxibustion until this kind of sensation disappear, then we call this is a session of heat-sensitive moxibustion therapy. And the time is different for different patients. Some patients, we use the bony mark stick on the heat-sensitive acupoint, and they feel, oh, I feel comfortable. I feel the heat go deep inside. And then we suspend the moxibustion on the point. After 20 minutes, patient may feel, doctor, this kind of sensation disappear, and then we stop. But some patients, this kind of time is very, very long, even 1 hour, even 2 hours. Then this kind of sensation disappear, and we stop. We call this is 1 session of therapy. So for different people, different time, it depends. The exploration of heat-sensitive acupoints usually involves a combination of 3 methods. So circling moxibustion, and the back and forth moxibustion, spiral packing moxibustion. So after this kind of warming moxibustion, and then we find the heat-sensitive acupoints, and then we conduct mild moxibustion. So this is the step. So now we do the example, neck pain. Now we give the example for neck pain. In our experience, from research experience, for neck pain patients, this is Fengchi point, and this is Dazhui point, and this is Jiangxi point. These 3 points are likely to be heat-sensitive acupoints. And so, suppose we found that these 3 points all belong to heat-sensitive acupoints. Now we do moxibustion, heat-sensitive moxibustion. First, we exploring the sensation. So this is a circling moxibustion. Gradually, we do circling. Keep 3 centimeters between the bony marks to the skin. And during the procedure, we always ask the sensation feeling of patients. What do you feel? 你怎么样现在? Feels very comfortable, he says. So this we call circling moxibustion. Do you feel hot? 热不热？不热是吧？有热进去吧？有一点哈。Now we do back and forth Moxibustion gradually. Now the patient's skin becomes red, and then we do spiral packing Moxibustion. 捏发捏发，别烫吧，这样舒服吧？ We do this Moxibustion for 1 minute for each step. "现在什么感觉？Now he's feeling the heat goes inside and skin becomes red. Now we do the mild Moxibustion. We just keep about 3 centimeters from the skin. We do mild Moxibustion, suspended Moxibustion. And then we ask the feeling of patient. 你现在这个热量到哪里了？往里面是哪个里面？是颈椎里面还是往头上吗？还是往下面？往颈椎里面。He says now the heat go inside, go deeply. 表面热吧？还好。And superficial, he doesn't feel so hot. So feels comfortable, and the heat go inside deeply. This is one kind of sensation of 6 phenomena of HSM. And then we just keep doing like this, and the time for different patients are different. And we just do Moxibustion until this kind of sensation disappear, and then it's one session of the therapy. Usually it takes about 20 to 40 minutes, like this. Now we give the example of lower back pain. Usually, in this point, we call 腰阳关. This point, just the gap below the L4. This is usually is the heat sensitive acupoint. So for this, now we do the about 1 minute circling Moxibustion. So far, about 1 minute. And then back and forth Moxibustion. They go back and forth along the 2 meridian. 现在有什么感觉？往肚子吗？往屁股。Now, patient feels the heat goes down to the butt. We can see the skin becomes red. And then this is spinal packing Moxibustion. Now he's feeling very comfortable. Now we do the middle Moxibustion. Now, 感觉怎么样？哪个大腿？右边。Now I ask the sensation. He says the heat go to the right side, to this point, to this area. 很舒服哈。And he is feeling very comfortable. Okay, today I share the basic knowledge of heat-sensitive Moxibustion technology with you, and demonstrated the operation steps. As the original innovative Moxibustion therapy technology of Jiangxi University of Chinese Medicine, heat-sensitive Moxibustion has a unique effect on allergic diseases, gastrointestinal functional diseases, male prostate diseases, female uterine cold diseases, spinal joint diseases, skin diseases, deficiency cold diseases, and so on. If you are interested in heat-sensitive Moxibustion technology, please contact us. Thank you.